brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about the great imitator, also known as lupus, a chronic autoimmune disease that can damage the body. Now, there's no cure for lupus, as we mentioned, but many have learned to manage it and live a full life. Express Care's Dr. Jitka Lom is here now to answer some viewer questions on the topic. Our first one comes from Mary from Twining. If my relative has lupus, what are my chances of getting it?
That's a tough question. You have a higher chance than another person in the population, but I wouldn't be able to give you a number. I guess if you have a brother or sister that has lupus, then you have about a 25-time chance of the regular population. So it's pretty increased risk, but any relative I really wouldn't know.
Okay. Jonathan from Barragota asks, are rheumatoid arthritis and lupus connected?
Yes, because rheumatoid arthritis is, again, a autoimmune disease. And when you said the great imitator, the reason that is the case is because people with lupus, it takes a while sometimes to diagnose them. People may think, well, you might have arthritis, or when they have fevers, you might have just a viral infection, or if they have seizures, well, you might have epilepsy. And so it takes time before these all come together and somebody figures it out and says, oh gosh, you have lupus. So yes, they are related. And sometimes people also have both. They have rheumatoid arthritis and lupus, and other autoimmune diseases such as diabetes and thyroid problems and so on.
So you can have
everything all together.
A mixture of things.
Yes.
All right. Tanya from Jigo asks, can smoking make my lupus conditions worse?
Definitely. Yeah. With smoking, you're again not oxygenating your body as well, right? Because you're poisoning yourself really with the fumes from the smoke, and your circulation won't be as good. So two things, you won't detoxify and you won't oxygenate as well, and then that's very harmful for your immune system. So you will have a worse course, more problems with your health. So definitely, you should always quit smoking, but especially if you have lupus.
Okay. Maria from Jontya asks, I've heard of people going vegan and cutting meat out of their diets, helping their conditions or making their conditions improve. Is this true?
It could be true. You know, the thing with lupus is that you can't say two people with lupus have the same disease, because they have a very different outcome, let's say, or a course of the disease. One person might have mostly kidney problems, the other person mostly skin problems, you know, any combination, any variety, and the disease changes and morphs over time. So it's always, it's very individual. So for some individuals, their diet may make a huge impact on them. The other thing is, if you already have an immune system problem, and then you're eating foods that are really wrong for you, like maybe you're allergic to a whole bunch of foods that you're not aware of, you don't really have symptoms, or you don't know that these are related to your food allergies, that's another thing that your immune system's dealing with. Lupus plus I'm eating all these wrong foods, so I have more symptoms than I would otherwise. So it's not that the foods are causing the lupus, but they may aggravate. So this is where it gets very difficult, and the therapy is very individual, person by person. What is the best course for that individual person?
Okay, so it affects people differently. And so the treatment, therefore, would be different.
That's right, and at different times in their life, too.
And I'm sure stress would play a huge factor.
Absolutely, huge factor, yeah. People with lupus need to live a very moderate lifestyle, again, staying out of the sun, minimizing their stress.
Okay. Rose from Dedido asks, and this is kind of related, can eating certain foods actually increase my lupus flares or joint pain?
Yes, it might, especially we call them the nightshade vegetables. These would be the ones that are potatoes, eggplant, tomatoes, and peppers. Those are called nightshade vegetables, and in some people with arthritis, it will make them feel worse. So that's something easy that you could eliminate and see if it helps you feel better.
When you say peppers, do you mean like the hot peppers?
I mean any kind of pepper.
Oh, wow.
Green pepper, red pepper, hot pepper, yeah. For some people. It typically is more the potatoes than the eggplant and the tomatoes, but in some people the pepper will also aggravate.
All right, sounds good. Joanne from Telefofo asks, how will I know if lupus is affecting my vision?
Yes, it could. Tragically, sometimes it does affect the optic nerve, which causes actual blindness. That's rare. But sometimes other inflammatory conditions can occur, like the pupil can become inflamed, redness of the eye, stuff like that. You would know because you would have symptoms. That's usually an easy one to pick up, where a person has a red eye, a painful eye, they can't see, something like that.
Okay, is there any other last words of wisdom that you'd like to leave on lupus for our viewers?
Well, I think if the most common symptom for people with lupus is fatigue, and then the red rash that looks like a butterfly right over their cheeks here and their nose. That's called a malar rash. And so if you see somebody with that, then they might get it checked.
Okay, and so speaking of lupus, I know that the lupus group on Guam is actually going to be having an event to talk about lupus and tell more people about it on May, I think May 25th?
That's right, excuse me. Okay. May 25th, there is a foundation on Guam, the Lupus Awareness Group of Guam, I believe, LAG, and they are having a information session for sufferers of lupus and also their caregivers and anybody who's interested. That'll be at the University of Guam on May 25th. It's a Saturday.
All right. And so thank you for all the information on
You're
lupus.
welcome.
You'll be back again next week when we will be talking about carpal tunnel syndrome as well as wrist injuries. You can send us a question to healthyliving@kwam.com. And before we throw it a break, we just wanted to ask you, Doc, we understand that you've got a new venture, and this Friday you'll be opening something that will make everyone have nicer smiles.
That's right. We're opening Bleach Bright, which is a tooth whitening procedure. It takes 30 minutes or less, and you get whiter teeth in that quick span of time. And we're opening up on Friday at the Agana Shopping Center, so we hope to see you smiling bright.
So it's pretty painless, I'm sure.
Oh, absolutely. Very painless and safe and harmless.
All right. Well, we look forward to telling our viewers more about it in the weeks to come.
Thank you.
Again, that grand opening will be held this Friday. And where is it again?
At the Agana Shopping Center, second floor.
Second floor. All right. Thanks, Doc, for coming in. We appreciate it. We'll be back to wrap up the show right after this. Stay with us.
Thanks.